to join with our government partner and to meet with our country team and our country director and to travel around the country to see how serious the situation is. Clearly, we know that, unfortunately, Somalia is facing very, very significant levels of hunger and malnutrition as a consequence of 3 now years of poor rains, failed rains, and now, of course, we're starting to see some rain in parts of the country, which is indeed bringing some hope, but has yet to bring any real improvement to the situation. We know that more than 6 million citizens of this country face severe or acute food insecurity. Almost 2 million people are in emergency levels of hunger and poor food security. Almost 2 million children face very serious levels of malnutrition. And there are parts of the country, at least one region in Burakaba, where we are seeing levels of malnutrition in under 5s that are almost 3 times the emergency levels as designated by the World Health Organization. So this should worry us all. It means that we all need to work together very closely, the Disaster Management Agency, the World Food Programme, other actors in particular supporting humanitarian efforts in the country, to really expand our coverage. The problem there, of course, is that, as was mentioned by the director of SODMA, we have other challenges in the world. The war in Iran, the problem at the Strait of Hormuz means that fuel costs in this country have gone sky high, 150% in some areas. The price of diesel has increased. Delivering assistance around the country is much harder and more expensive. Delivering commercial goods around the country is harder and more expensive. And people are suffering because of that. And we actually now face problems that we haven't faced before in terms of these different shocks, these different crises coming together at the same time. I was in Puntland earlier this week, going to a mother and child healthcare centre, where we met mothers who had brought their children, in some cases hundreds of kilometres, to reach an area where there was water, to reach an area where there was food, to reach an area where there was pasture land for their animals. For most of their animals, it was too late. They died en route. People lost their assets. They lost anything that they had in terms of savings, in terms of their cattle or their sheep. And now they're facing a situation where organizations can only provide treatment for malnourished children, no prevention. There's simply not the resources. There's not the nutritious food in stock in the country to help everybody. So people are having to take really tough decisions. Who to help, who not to help, just as Dr. Hamid mentioned. We are going to be working in the closest of coordination with the Disaster Management Agency to make sure that we can stretch every dollar. We know that the people of Somalia, citizens of this country, do not want to be dependent on aid forever. This is not the time for that debate. This is the time to prevent death. That's what we need to focus on right now. And then we can go back to making sure we can start building recovery, building resilience, rebuilding people's livelihoods, so that in future these shocks are less impactful. But right now, make no bones about it, we need to be desperately helping people across this country who are facing really awful levels of deprivation. I go back to our headquarters reinvigorated to engage more on Somalia, to find more support, whether it be from donors or diaspora, because this country desperately needs help today. Thank you for your time. Please amplify these messages. The people of Somalia need it. and we need your help too. We need so much more in terms of resources, but we need to make sure that this is going to be an emergency response at this stage that needs to be scaled up at very significant levels. Thank you.